Hi, Vince Negro here. Just wanted to let you know that the War Room, we have come to an end. We are going to be putting the War Room on a shelf for now. We've had an unbelievable run with the program for politics, but the program has expanded into many, many other areas. So we're rebranding the show. We will bring the War Room back when we talk about our political programs that are coming up, whether it's provincial, federal, municipal, or global politics. We will be using the War Room, but we are launching our new branding, Insights. Our new program, as of today, will be called Insights with Vince Negro. I hope you enjoyed, and please give us any feedback along the way. Thank you, and enjoy the program. Barb Collins, welcome to the program.
Thank you very much, Vince, for having me here.
Yeah, thanks for having us here. I know that you are someone that, with this particular hospital, Humber River, which we're sitting at right now, and we'll talk about the command center and all the AI components to it. You had a hand in this from everything from construction to design. You really know your way around here, as opposed to some people walking in when it's all done, it's all packaged, and they're walking it on. You actually have been here from the beginning and had your hands involved in every aspect of it. Can you give us a little sense in terms of how that came about for you?
Be happy to. I joined Humber in 1999 as a vice president and then chief operating officer. My background is clinical. I've been a nurse for 48 years, long time.
Yeah, I love
and
nurses, by the way.
Thank you very much. And so I had the opportunity to lead many clinical areas, but the opportunity to also have maintenance and engineering and buildings report to me of our 3 old sites. In about the year 2001 or 2, we recommended building a new hospital as opposed to repairing our old sites. And at that time, I worked with the then CEO, Dr. Ruben Devlin, and we worked together with the board of directors to say the right thing to do is to move to a new site rather than try to build 3 old hospitals. So when I became the chief operating officer, and because of my clinical background, I was one of the people that led the design of the hospital. And it's truly a fabulous opportunity after you've been working for 35, 40 years in healthcare, and a once-in-a-lifetime opportunity to have a chance to build a new hospital. And you bring big teams and people together, you have engineers and architects, but having that clinical background, understanding what a patient room looks like, thinking about all of those kinds of things that are necessary in an operating room, was really wonderful to put some of that into practice and design a facility. We had a really huge desire to develop a facility that would make it easier for staff to deliver care, for staff and physicians to deliver care, that would make it safer. And we realized it was technology that would do that. When you're building such a big building and all these single patient rooms, there's no way you're going to do it with design. You've got to incorporate technology.
Barb, I mean, you have an impressive resume. Like, as you said, you've been involved in every aspect, moving up the ladder. And when you finally got to this culmination in terms of Humber River, the beauty that you have is that, you've actually seen and you've touched a lot of areas within the healthcare. And, they always talk about the human touch. We'll talk about the command center and the AI component to whatever. And everybody, when they think of that, all machines.
Yeah.
But there's always a human touch.
It's
you
always
still need that human touch.
You do.
And as you were progressing through the process to come to where we are today at Humber River in terms of the command center and the hospital where it's standing, the human touch, did you have that in mind as they were telling you we're going to put together this AI hospital, this technical hospital? Were you kind of caught in terms of how you can bridge the two together?
We were. And I'll tell you that one of the things that's really important to me as a leader is engaging the people who you work with. If you don't engage the staff, the physicians, the volunteers, they don't feel committed to the organization to accept and try the change. They don't feel committed to the organization to focus on quality patient care. And I've always believed we're all here for our patients. But as leaders, we're here for our staff, our physicians, and our volunteers. And we need to consider their concerns. We need to try to resolve their concerns, help them understand the new technology, put in place technology that makes their life better. But you know what? It's still about the day-to-day. Yeah. If your time schedule bothers you, if you can't get a piece of equipment, if there's something that we call pebbles that irritate you, it's our job as leaders to remove those pebbles. And then to lead the way by communicating with our staff, our physicians, our volunteers, walking around and talking to people, caring about the people we work with. If you don't care about your staff, your physicians, your volunteers, if you don't care about your employees, they're not going to care either. And so it's really building that relationship of friendship.
Yeah, and it's building a relationship. So when you knew that this was going to be an AI, a technical, state-of-the-art hospital, and it's being built, most people are watching the program. This particular beautiful hospital is located at Keele and Wilson area.
Right.
And the old transportation, I believe, site, it used to be the old Ministry of Transportation site. You're putting it together, and in the city of Toronto, there are other hospitals. There's UHN, there's Western, Sunnybrook, whatever. What is the actual difference between the two hospitals that you would say are different than the other hospitals?
I think the difference at Humber is that we really had an opportunity to start a greenfield site, so brand new. You're not adding to, you've not got older parts of the building, newer parts of the building. And so if you can, and you get the opportunity to go to what we call a greenfield site, a brand new site, you're starting over with a blank slate. So you can begin to look at what's efficiency look like. We can have the same technology everywhere in the hospital. Do we want that? We can build rooms that are large enough to add that technology. We concentrated a lot on flow of patients, how they get in the building, how they get through the building. We worked a lot on how much people have to walk around and how technology would help. That is a great opportunity when you've got a greenfield site. And every hospital who's building on a brand new piece of property, I remind them of that. That's an important aspect. It is a little harder when you're tearing wings down, adding wings, moving things around, because you have different vintages of building. And you need modern for some of the technology, or it takes a long time to introduce it. So I really respect that we had a great opportunity to build a brand new site.
Right. And I'm sure you're always adjusting and pivoting as well in terms of learning, and that there's a learning curve or whatever. I know that this particular hospital has an unbelievable turnaround time in the emergency. I know there's a new report that got dropped that put you guys high up there. Yeah. The surgeries and the care, obviously, they use the word robotic. You hear robotic in terms of that kind of stuff there. Is the turnaround time for surgeries, whether it's hips, obviously, people like Kevin O'Leary, he's all over social media. He came in, he had 2 hips, and it was a great kind of how he got out of the hospital very quickly. Having this hospital the way it's set up as an AI hospital, technical hospital, is the surgery pieces that happen also a way of getting people out and home quicker?
Yes, it is. And I'll give you an example of that. Most often in a hospital, you'll do 3 or 4 total joints, maybe 4 in a day. We have the robotic technology for many of our surgeries, which allows you to be less invasive, less cutting. It allows you to use different approaches and to be very accurate with the placement of the joint. We have combined that with our anesthetists who have a wonderful pain management program. And so our patients are up walking within an hour of their surgery, as Kevin O'Leary said. They go home the day of. And so we have beds to bring the next patients into, but we've also been able to modify our processes using our technology to ensure that we can do up to 12 surgeries a day. So if you're using the same OR team to do 4 surgeries and you move that same team to get 12 done because you've introduced technology, your wait times are going to be a lot less because you're doing twice the amount of surgery in a given day, which is important for all of us, right? It's important for every procedure we can do that for, we do.
Well, the old deal is a hip would be 3-4 days in
3-4 days in the
Now,
hospital.
you're, like you said, you're up within an hour or 2. And
You go home that day.
we go home that day.
And you don't have pain. We follow up with you, and you do your therapy, and patients do very, very well that way.
Barb, in terms of the employees that work here, whatever, do you find that with an AI technical, with the command center, which I'd like you to talk a little bit about in a few minutes, do you find that it's more efficient, you have less people, and turnaround time is a lot better?
You know what it allows you to do? It allows you to use technology that staff and physicians can spend more time at the bedside. And there's lots of pros and cons to technology, as you and I know. But if you train people well on it and you focus on what's the process you follow to deliver care, and how can I help you with that? And so we did a lot of that. Our laboratory results, for example, as soon as the blood's drawn, it goes to the lab by a pneumatic tube system. That tube isn't touched again. It goes into the machine, it does the blood work, it comes automatically to the chart, it goes to the patient's handheld record. We're not spending time looking for pieces of paper, recording it in charts, adding it to charts. Wherever you can automate processes, you make it easier for your staff and your physicians. If you automate the right things and you make it easier for people to do their care, then accepting that technology is better because it makes your life easier. It's like you and I, we're happy with our cell phone because it makes our life easier. If it made our life more difficult, we wouldn't be using it. You have to think the same principles as you introduce technology.
Right. Barb, before we talk about the command center, I just want to just go back to you. As I said, you have to be, I love nurses because my daughter's a nurse.
Oh, is she? Lovely.
And, I see how hard they work. I see how hard she works.
They do.
And whether a nurse practitioner, and yeah, there are doctors, are great doctors, whatever. And as you know, I feel that nurses are the core of most of these hospitals because they are the lifeline of people beginning, middle, and end. And I just see the wear and tear on nurses. And you being a nurse and coming through that rank and now being the president and CEO, people are watching the program. We get a lot of people watch the program and say, wow, Barb was a nurse. Can you tell us a little bit about your journey from the standpoint of when you became a nurse? Did you decide to become a nurse when you were in high school? How did that come about? Tell us a little bit about yourself.
So 50 years ago, you kind of were a nurse or a teacher, many women, right? Yeah. So I did choose nursing when I was in high school, and I was quite young when I went into nursing. But I enjoyed it. I believe we do good for people. And I think if you're a kind of a giving or a caring person, nursing is still the right profession for you. And so I enjoyed nursing. I very early on became a manager because I felt like I could help my colleagues, I could help staff be happier, and that's always been my focus. If you think about it, a nurse spends more time with her team at work than she does at home with her family in any kind of a scenario if you're working full-time. So that has to be a good experience. It has to be a friendly experience. You have to be able to work well with each other. You might argue, of course we always do, but can you get along and can you solve problems? And so I've always believed that our job as leaders is to help people do that. And I expand that even in the CEO role. We don't always agree with everything, but are we communicating? Are we talking about it? I think those are important aspects of it. And so I moved through the continuum of different roles, as you do in hospitals, because I believe that in each successive role, I had more to offer in terms of communication and being authentic, be who you are. I'm a nurse. People know I'm a nurse. I tell people I'm a nurse. I speak from a nursing background when I speak to people. Doesn't mean I don't understand environmental services. I don't understand maintenance and engineering. I don't understand where our physicians are coming from, but I understand patients and I understand patient care. And I still believe nursing is a terrific profession. At Humber, we have worked very hard, and our technology has helped us. We actually only have about a 2% vacancy rate in our full-time nursing, which is terrific. But again, it's about communication, make an environment people want to work, make people's lives easier, their jobs easier. Because when you come to work for 12 hours and you're working with patients, it's a lot of effort, and you know that from your daughter. Sure. So it's our job as leaders to try to make that work as well as they can, to be there and to be supportive. And I say to healthcare leaders, hospitals are open 24/7. And the interesting thing is, if we're only here Monday to Friday as leaders, we may be missing a whole lot that goes on after hours and on weekends. So be around, be available to people, help solve problems all the time. That's our job.
You also strike me as someone that a lot of people use words, but they don't mean them. You seem like someone that what you put out there, you actually mean. It comes through in you. And you can feel that with people, and it's nursing and whatever. You can feel that when someone really cares. And there's a psyche that psychologically it really does help. As much as that sounds, it really does help.
You have to be authentic. You have to be who you are, and you have to care about the people you're working with.
So we're sitting in the what we call in the command center. It looks like a NASA space, like NASA here. Can you tell us a little bit about the command center, how this came about, and how it continues to work and improve every day? I'm sure.
I will. I'll tell you a couple of things. When we started designing the hospital, we realized we would have all this digital technology downloaded into the chart automatically. Nobody had to do things to do that. And we knew that there were three things in healthcare we wanted to solve. Every day of my life for years, and in some hospitals it still is who's got a bed, how are we going to get them there, how can we clean the emerge out, who's going home, what are all the delays. When you spend your whole day doing that, that's your focus, and it's not a fun focus day after day after day. So the first thing we wanted to do was use our technology and our data to tell us who's in emerge, when did they arrive, how long has it been since they've seen a physician, do they need a bed, is there a bed for them to go to? In hospitals, it's all about input and output. Patients come in, you've got to have a bed to put them to. That means somebody needs to go home. We designed the first component of our command center for flow. We wanted to know from the moment a patient was arriving in emerge, how long it would take us to get them to a bed if they were admitted. And then the people that are in beds, what is delaying us from getting them to go home? If they're waiting 2 days for an MRI and they're just occupying a hospital bed, let's speed that MRI up. If they're waiting for laboratory results or a physiotherapist to see them or social worker, let's know that's the delay and let's speed that up. And that really has allowed us to flow our patients through the hospital very quickly. We can come in the morning and emerge and we can have 12 patients that need a bed. We will have them assigned to a bed by 10 o'clock in the morning because this is a continual process. But it doesn't take up every minute of our day. And I remember the years when it took up every minute of our day. You'd have what you call bed meeting and bed placement discussions 6, 7, 8 times a day. We do that once a day now. We have very good occupancy. Our patients get to their emergency department, from the emergency department to their admitted bed in record time. And we have, to date, never had to cancel a surgery because we didn't have beds to put patients in. Right. So that was monitoring what's going on, both on the input and the output side of patients, and smoothing their care. Big component of flow. Once you solve that, then as a nursing team, a physician team, you can begin to look at what are the safety issues we want to solve with our patients. And it's a fact in Canada, and it's a fact around the world, that following discharge, we find patients who have undergone harm in the hospital, not related to the reason they came in. Might have had a wrong medication, a wrong drug, we might have caused delirium, they might have fallen, they might have developed a bed sore. It's a shame that somebody comes in for care of some sort and we make them less well upon discharge. And in Canada, the Canadian Institute for Health Information actually tracks what was the harm rate of patients upon discharge. And across Canada, it's been for a number of years around 6% of the patients, 6 to 6.2% of the patients. And we knew that with our data, we had the ability to pull out of the charts into the command center and now on the units. Here's a patient that might be deteriorating. Their condition is changing. Maybe this isn't the best drug for them. So we have insight into all of those things. And as a result, we're able to intervene sooner in their care, call the nurses and say, do you need another physician up there? Do you need more staff? What is it we can do to help speed the care of this patient so they don't get sicker? Across Canada, we've been doing this now since 2018. Our rate has been 60% better, 60% less harm than any other of the hospitals across Canada and Ontario. And we've maintained that since we put the command center in because we use our data to monitor patients. And I'm sure if you ask your daughter and young nurses, it's very comforting to know that there's that backstop. While you're running around delivering your care and being very busy and maybe really occupied with one particular patient, the data is coming up in the command center and somebody's going to call and help you solve the problem. And that's what's really worked well as our safety component.
Very nice. We can talk all day about what you said. I'd like to take a little bit of a tour of the command center, but just finally, I know that it's a new hospital. It's a state-of-the-art hospital, but you're always trying to improve the hospital. You're always obviously trying to raise money.
We are.
Money's always an issue, and you're always trying to improve it. What else is on your agenda over the next, say, 4 to 5 years that you'd like to see happen here at Humber River?
Well, I'll give you a few ideas. First of all, we're 9 years old. So there is replacements, 9 years old. So of course now there's newer technology even than we have. And we have a plan to continue to replace our technology, but it all costs money. We want to stay leading edge. We want to continue to be able to develop these things. So that's an important component. We have proposed to the Ministry of Health that Northwest Toronto needs a cardiac catheterization lab. And we are partnering with University Health Network on trying to bring a cardiac catheterization lab here. Those are expensive to build. We have some money available, but support for that would be wonderful. We believe that we have a lot to offer in our digital technology and in our in the work we're doing. And so we are going to launch, or in the process of launching, a research institute. And our research institute isn't going to be, University Health Network, Mount Sinai, Sunnybrook, those hospitals are doing the bench research of curing cancer. We want to talk about digital technology efficiency, how we can use AI to make care safer and smoother. And so we're putting together a research institute in that, and a simulation lab. Simulation teaching is the proper way for physicians and nurses and physios and all people in healthcare to understand how to treat patients well, to use the technology well. So those are some of the things that we're working on. Northwest Toronto is a community with a lot of needs. It's it's an equity-deserving community. There's lots of disease entities here, and we need to expand our care into the community. We need to be able to monitor people in their homes and try to prevent them from coming to the hospital. So there's many opportunities in that area as well.
Well, I'd love to take a quick
Happy to take you on a tour.
of the command center. We appreciate you very much in terms of giving us a little bit of an insight into the hospital. Would like to stay in touch with you, and as things evolve here at the hospital, maybe keep us in mind and come back and we'll chat about some of the changes you're going to be making. And we're here to support the hospital. It's amazing. I believe it's a state of the art. It's the future. It's the way to go.
Thank you.
Especially when you get people out the same day after surgery as opposed to 3-4 days.
Yeah.
And, the whole mental psychic is good because when you feel good, you actually want to participate, and you want to give back. And I think it's so important to stay involved in the community. You're in the heart of the community. I know there are other hospitals, but I think it's pivotal to have folks see what you're doing here. And it's very impressive. And I would really appreciate you giving us a little bit of an insight in terms of what you do here.
Well, thank you very much, and I appreciate the opportunity. Our community is getting to know us much better. Our patient satisfaction result, we ask our patients, about 50-60% of them after they've been discharged, would you recommend Humber River Hospital to your family and friends for care? And 87% of our patients say they would. So we've got the kind of quality care going on that the public deserves and they expect at a hospital. And so we're hoping that helps us help people understand that hospitals have needs, but we're here to look after them.
Well, Barb, just finally, I've interviewed a lot of people, and just interviewing you today, I can tell that they're not just words. It's real, and it's a real feeling, and I really appreciate it.
Thank you very much.
Yeah.
We'll go and look at the command center.
Thank you.
All right.